So, as I said yesterday when I wrote my blog post, I said that I was going to start introducing some videos into my blog. So this is a go at my first video. As I said, what I'm going to do is I'm going to do a lot of shorter videos, but this first one is basically just going to be a little bit about my Crohn's colitis story, and then I'm also going to cover the question, what is an ileostomy? So first, my Crohn's colitis story. Well, if you want to read this in major detail, it's on the top links on my blog, so you can find it there, but I'm just going to go over a little bit of the reason why I ended up with an ileostomy. So when I was 7, I was diagnosed with Crohn's disease, and I had all sorts of things to kind of try and treat it, and Crohn's typically is in the small intestine. So that's where I got treatment for it. I had things like mesalazine, I had pentasa, I had prednisolone, which is also steroids. I went on the elemental diet, which is where you go down to liquid feeds only, which have got all the nutrients in that you need. I was on those twice for about 8 weeks at a time, and to be honest, I got very, very poorly when I was in the children's clinic, and I also had things like I had a blood transfusion. I had barium enemas, I had barium meal follow-throughs, I had x-rays, ultrasounds, everything really, to try and find out what was the best treatment for me. And I always had a fear of having colonoscopies. There was one time where I'd had an enema to prepare my bowel for the surgery. Sorry, not the surgery, the colonoscopy. And I remember my dad pretty much and my nurse had to physically hold me down to the table because we didn't know this at the time, but my rectum had got so narrow that when they put the enema up my bottom, it was absolute agony. And that bed experience, we kind of kept away from me having colonoscopies quite a lot. And then I moved up to the adult clinic when I was 17, and I got a re-diagnosis of Crohn's colitis. By this time I sort of got the guts, no pun intended, I got the guts to have another colonoscopy, and that showed that actually my Crohn's disease was in an area that was away from the typical area, that's the small intestine, and in fact it was in my colon, which is my large intestine. So in effect, that area had gone untreated for 10 years, which is why the disease had got so bad. I was then put on azathioprine, which is quite a strong drug. There are quite a lot of side effects with it. Well, I guess every tablet does have its side effects. And I was also put on infliximab infusions, which can also be called Remicade infusions. And I had those anything between every 2 weeks to every 6 to 8 weeks for about 6 hours in hospital. And what they did is they'd put a cannula, which is a little needle, into the back of my hand or up my arm, and it'd infuse into my body. And I was also given an anti-allergy tablet before I had those to stop my body rejecting the protein that was coming in to try and sort of heal my disease. When I was on the infliximab, I felt quite well, but then I had a scope after I'd been on it a year, and it showed that things hadn't got any better, and the severity of the disease in my colon right through to my rectum and my anus was just vast. It completely covered it, so it was then decided that I needed some sort of surgical intervention. That was at age 19, and yeah, the operation, I originally got told that I'd need a resection, but then when I actually met up with the surgeon that would be doing my operation, because of the extent, I was told that I would need a permanent ileostomy, which, to be honest, like it would be with anybody, it was a shock, a great shock. But I was so ill by this point that I just, whatever it took to get better, I wanted to take the chance. So then it was decided that I was going to have my permanent ileostomy. And I had that in August 2011. So I've had that for around 2 years and 7 months now. So now I'm going to move on to the next bit of the video. That's what is an ileostomy. Well, an ileostomy, it's where they bring the end, or they bring a loop, if you have a temporary ostomy, of the small intestine out through the skin, so that there's a new diverted opening for your waste to come out of the body. And the stoma itself, it looks like a little rosebud on your tummy. It looks quite, I've been told mine's quite cute, but they can come in all shapes and sizes, and mine is quite tiny. It was about 30mm after my operation, but now it's shrunk down to anything between 23 and 25, so you can imagine it's about that maybe, it's quite small. In my case, I had all of it taken away. I had my colon, my rectum and my anus taken away, as I've said, because of severity. An ileostomy, it tends to be on the right hand side of the body, but you also get people that have it on the left for different reasons. You know, if they've had one stoma and for every reason it's gone wrong because of scar tissue or it's just not functioning right, then the surgeon might decide to construct it on the other side of the stomach. And then obviously, because the waste is coming out and you're incontinent, you can't control when the waste is gonna exit the body. You have an ostomy bag, which I will show you. Mine, I have a stoma waistband on, which is something that helps hide it under my clothes, as you can see. But that is an ostomy bag. As you can see, that's my scar, and the rest of my ostomy bag is tucked away in my trousers. Yeah, reasons for having an ileostomy aren't just because of Crohn's. Obviously it can be for other inflammatory bowel disease conditions like ulcerative colitis, and there's also lots of other reasons that people can have them, like cancer or trauma due to an accident, or I've even known of some people who have had to have an ileostomy because of complications of childbirth. You know, there's a whole multitude of reasons why people can have an ileostomy. Like I said, they can be temporary or permanent. Temporary tends to be if the rectum and, you know, parts of the bowel that you need to function are still intact, but they might just need a rest. And quite a common one why people might have a temporary ileostomy is if they're having a J pouch formed, and the surgeons, once they've created the J pouch inside the body, the internal pouch, they kind of have to leave it to heal for a minimum of 4 to 6 months. So whilst that's healing, the patient is given an ileostomy so that, you know, the waste can still exit the body, but the body's having the healing time it needs. And then if the J pouch is successful, then that bowel gets put straight into the body and it's connected back up, and hopefully the person can use the J pouch and they no longer have a bag. It's permanent if, for example, a J pouch might fail and it might need removing, and then in which case the person will have everything else taken away if there's no other option of the bowel that's diseased, and they'll have a permanent bag. Obviously it's permanent because of the extent of things that get taken away, like I said in my case, and also because of the things they take away. They close your bottom, they sew it up, so depending on the surgeon they might remove the muscles down there as well, but it depends on what the surgeon thinks is the best for your healing process really, and obviously the rectum and the anus gets taken away as well. You can get a colostomy, which is where a section of the large intestine, the colon, is brought out through the abdomen onto the skin. And you can also get things like a urostomy, which is used to divert urine out the body via a stoma on the skin. That's basically all I'm going to say in this video, apart from, I think one of the main points to say is that for a lot of people, an ileostomy saves their life. It's not a case of you have a choice. For me, I did not have a choice. It gave me my life. And literally, I would not be here if I did not have my stoma. When they did my operation, they also found a large abscess. So if it had been left another 2 or 3 days, I might have not been here. So really, my ileostomy was the difference between life and death. And when I get my down days, that's the main thing I focus on. It gave me my life, and that's what you need to remember, really. I do have my down days, but I always tell myself that my stoma gave me my life. Thank you for watching, guys, and if you have any comments or anything, please feel free to leave them, and hopefully I'll do another one soon.